Hello and welcome to Eskimo TV. I'm talking today to Dan Smith. Dan is the Director of Sports and Spinal Physio in the UK and is the lead physiotherapist. Hi Dan, how are you?
I'm very well, thank you, Joanne.
Dan, let's talk today about work-related neck and back pain. I'm sure a topic that many people can relate to. So why is back and neck pain one of the most common work-related injuries?
Back and neck pain is probably one of the most common injuries that we see in our clinic anyway. The back pain in the UK costs the NHS system approximately £4 billion a year in treatment. So it's a very common ailment. The spine is essentially a very strong, robust structure, and it's essentially the foundation for our limbs and ribcage to attach to. While providing this strength and stability, it also offers us lots of freedom of movement. So every task we do on a daily basis, our spine is under load or under strain as a result. Now, because 1/3 of our day is spent at work, it's no surprise that most people, when they're at work, will develop symptoms in their spine or back.
What are some of the major causes for this?
I break them down into two groups. The sedentary workers, so our office workers. Now, these people sit at their desk for many hours, placing their spines under sustained loading for up to 8 to 10 hours a day. This can cause malalignment or poor posture, muscle imbalance, and these lead to aches and pains due to strain of the tissue, such as the joints and the discs. The human body is evolved to be upright on 2 feet, walking around, but most of the time we just sit down at our desk or in our car, which our body's not really designed to do, so the spine doesn't like this. The second group are our manual workers. Now, this group of patients, they often have heavy lifting to do as part of their job or repetitive movements. And it's this heavy lifting and repetitive movements that places the spine under a great deal of strain and causes what we call micro-trauma to occur. And over time, this develops into wear and tear, and then they get pain and problems.
As a physiotherapist, how can you step in and treat people already suffering with work-related neck and back pain?
The first thing to do is to assess them, to assess their spines and to assess their lifestyle to see if there's anything we can do there. Once we've assessed them, we normally put together a treatment program, and that treatment program will include hands-on manipulation or mobilization, addressing postural needs, so their postural alignment, muscle imbalance would be addressed with exercises to strengthen or to stretch the groups of muscles that needed it. And then we'd look at other things, such as if they were a sedentary worker, we might decide to look at their desk setup. This is called an ergonomic assessment. Or if it's a manual worker, we might decide to do a risk assessment of their job.
I suppose one of the most important questions to ask is, what should people be doing at work in order to prevent these problems?
I mean, the first thing is to actually take notice of their job. So for, again, the sedentary workers, my top sort of 5 points would be: ensure that you're sitting in a chair with arms, and that the arms are adjusted so they support your elbows and your shoulders, because this takes the weight off of the spine by taking some of the load through the chair arms. The second point would be have a desk that's at the same height as the chair arms, so that the surface support is the same level. After that, the screen needs to be adjusted so that the center of the screen is at eye level. If the user uses a telephone, they need to make sure they've got a headset. And then finally, document holders. Document holders are very important. So a document holder should either be in front of you, so that you can see the documents you're referring to, or attached to the side of the screen. And then for our second group of patients, the manual workers, they need to have their jobs assessed. So they need to make sure that if the load is too heavy, they get help to lift the load. And if the movement is a repetitive movement that's likely to strain them, then again, that needs to be risk assessed, and an alternative method of doing the job may be sought.
Dan, just to end off, what are some of the causes of neck and back pain that may indicate that a consultation with a physiotherapist would be advised?
And the first one is neck pain or back pain, and this can be either in the spine, so in the actual neck or back, or it can be radiating into the shoulders, down the arms, or into the buttocks and down into the legs. aches and pains shouldn't be ignored, and I always say to patients, go to the physiotherapist before these aches and pains turn into real pains that are going to cause you loss of earnings or lost time with your family. So seek professional advice early, really.
Thank you, Dan. Thank you so much for talking to me today.
You're very welcome. You're very welcome.